Good day, everyone. Today we are going to talk about spontaneous miscarriage. This video does not only intend to provide education, but also hopefully bring awareness, offer support, and bring a meaningful message to this topic. Spontaneous miscarriage is the pregnancy loss before fetal viability. It is classified based on the gestational age when the pregnancy was lost. When the miscarriage happened before 16 weeks, the miscarriage is classified as early miscarriage. Meanwhile, late miscarriage happened between 16 to 20 weeks. Spontaneous miscarriage is quite common. In the Philippines only, pregnancy losses account to approximately 11% of pregnancies. 88% is due to spontaneous miscarriage. 7.7% are induced abortions, and 7.7% are stillbirths. Local factors such as healthcare access, maternal health, and reporting practices influence these statistics. Spontaneous miscarriage affects many families, and while it can be heartbreaking, it's important to remember that in most cases, it could not have been prevented. Here are some common causes of miscarriage. Chromosomal abnormalities are the most common cause. They happen when the baby's genetic material isn't formed correctly. These changes occur naturally and are not caused by anything the parents did. Teratogenic factors may also be involved. These are harmful substances or exposures like certain medications, chemicals, or radiation that might affect the baby's development if present during early pregnancy. Implantation issues may occur. This means the fertilized egg wasn't able to attach properly to the lining of the uterus. When this happens, the pregnancy cannot continue. Hormonal imbalances can also be a factor. If the body doesn't produce enough of the hormones needed to support a pregnancy, the pregnancy may end early. Maternal infections may lead to a miscarriage as well. Infections such as rubella, cytomegalovirus, or severe cases of food poisoning can sometimes harm the developing baby. Lastly, alcohol consumption during pregnancy has been linked to miscarriage. Alcohol can affect the baby's development, especially in the early weeks before a woman may even know she is pregnant. Although these are known causes, it's important to understand that in many cases, the exact reason for a miscarriage is never found. No one is to blame. Miscarriage is often a natural part of reproduction, and nothing could have been done to change the outcome. Signs and symptoms to watch for in spontaneous miscarriage. Vaginal spotting or bleeding. This may be light or heavy, and can vary in color from pink to red or brown. Cramping or pain. Discomfort is usually felt in the lower abdomen or pelvic area, similar to strong period cramps. Passing tissue or clots. Tissue from the uterus may be passed through the vagina, sometimes along with blood clots. Decreased pregnancy symptoms. Nausea. Breast tenderness or fatigue may suddenly fade. Types of miscarriage and their accompanying characteristics. Threatened miscarriage. Vaginal bleeding without cervical dilatation. Imminent, inevitable miscarriage. Cervical dilatation with cramping and tissue passage. Complete miscarriage. Full expulsion of fetal tissue. Incomplete miscarriage. Retained products of conception. Missed miscarriage. Fetus dies inside the womb but is not expelled. Recurrent pregnancy loss. 3 consecutive miscarriages. The complications that may arise from spontaneous miscarriage depends on the situation, but listed here are some of the common complications. Hemorrhage. Heavy bleeding may happen if tissue remains in the uterus. This can lead to significant blood loss and may require treatment. Infection. If the uterus doesn't fully empty, an infection called septic miscarriage may develop, causing fever, pain, and foul-smelling discharge. Rh isoimmunization. If the mother is Rh negative and the baby is Rh positive, blood mixing during miscarriage can lead to future pregnancy risks, unless treated with Rh immunoglobulin. Emotional impact. Grief, sadness, and anxiety are common. Emotional support and counseling may be needed to help cope with the loss. If you suspect a miscarriage, here's what you should do. Stay calm and contact your physician immediately. Quick action helps ensure proper care. Avoid self-diagnosis or self-treatment. It's important not to make assumptions or take medications without medical guidance. Follow your doctor's advice carefully, whether it's rest, tests, or treatment. And most importantly, prioritize your emotional well-being, not just your physical health. It's okay to ask for support and take time to heal. Miscarriage is more common than we often realize, and yet, it's rarely talked about. Behind every loss is a story of hope, grief, and love. To those who have experienced a miscarriage, you are not alone. Your loss is real, your feelings are valid, and your healing matters. To those who are listening to this, let's advocate for better care, emotional support, and understanding for every parent who has carried both life and loss. Thank you for listening. Here are my references.